Thank you, Dr. Becky Cooper.
Thanks so much. So we're going to stay with unpaid carers, if that's all right. And I just wondered, listening to the numbers and the census conversations, are you able to give us a number about how many unpaid carers there are currently?
Well, it really depends which survey you choose, because they have slightly different questions
top
and
three,
slightly different
answers.
answers. Yeah. So if we look at the census, it's 4.7 million in England.
Okay.
The census question changed, so we actually had a drop in the number. Scotland did theirs 1 year later and had an increase. And they used the same question as before. So there are slight differences in questions that you ask. As Anita said, what we saw in the change between 2011 and 2021 there was actually an increase in substantial care. And there was also, that census also returned results where there was a drop in disability. So you see that's a sort of, we're seeing that as a slightly sort of different type of result. If we go to the GP patient survey, for example, they suggest there might be around 16% of the population, sort of 9%, 16%. So, and some of our surveys return when we do polling between around that level. So there could be as many as over 10 million or 8 million. The bottom line is there are millions of people doing this, and each data set has its own merits at looking at different interactions. So there isn't sort of there's rarely one figure, if you like, but just taking the principle that it affects many people. If we look at the churn on and off, I will also want to say it's not a static figure either.
No, I appreciate that. It is interesting that it's so broad, because obviously we're calculating based on presumptions, but you look like you've got a ballpark somewhere between 9 and 16%. There's sort of there's a range there you can be relatively confident in. Okay, thank you. So if we're looking at that number, and then I'm thinking about the Casey report, what are your thoughts about what social care reform should actually deliver for unpaid carers and also for society as a whole in terms of care? Is your opinion that we should be looking to reduce the number of unpaid carers? So we should be looking, you talk about sort of targeted social care. I've heard that very much, about the right type of social care being provided, and commissioning in an outcomes-based way. I appreciate that's difficult, but I think it's laudable. So should we be looking at reducing the number of unpaid carers, or should we be looking at, you talk about the benefit for carers at the moment being low. I know the sort of employment earnings limit has been announced as an increase this week, the DWP. Where are you sitting on that spectrum in terms of what you think should happen in this reform?
So reducing the unpaid at the end of the day, this is a choice, even if some people don't feel they have a choice about caring, and particularly about, when we look at young carers, it's a very good example that what we need to be doing is giving people the right opportunities in life to work, to connect, to be well. And families will still care. A lot of people will still choose to care. So I think government's role really is to support them to stay and work, to support their education, to support their well-being. And that will be different for every family. Some families might decide to do it all themselves. Others need more support, and for a whole variety of different reasons. So I think that's very important. And so the broader aspect of this is absolutely critical for us, and social care is one point there. Workplace rights is also important. The flexible working rights that are coming through the Employment Rights Bill are very important. In the future, we'd like to see paid carers leave, so that we turn the unpaid carers leave entitlement, which, the last bill brought in, which is very important, turn to paid. And we need investment in social care to reduce those health impacts of caring. And we can't leave families in poverty because they're unable.
Okay, so it sounds like you're talking about broader reforms generally.
Yes, for us it has to be has to be broader.
And I understand that. Ona or Anita, is there anything you?
I'd add one thing. I think looking at, well, there are two things that I would add. I think this issue of more and more of the formal social care system being devoted to people with very high packages of care, yeah, which has reduced the amount of lower level, if you like, interventions, both earlier interventions and lower levels of support. Now, that's a completely understandable change when you've had funding constraint. But often, obviously, what that may well affect is the sustainability of the informal care. So really thinking through, it's unlikely, I think, that most people who care will choose will elect no care at all. But the extent to which doing 50 hours a week of care can be seen genuinely as a choice. Some people it will, but many people are doing very high intensity, both in terms of hours and types of tasks, that, you know, if they had appropriate support, would free them up actually to have more of the time and relationship that they would want to have, that they, as the person's loved one, uniquely bring. So I think that's something that I hope the Casey review will look at, and how you can do that. The other thing is that the Care Act, again, I was just trying to look through my notes, I can't find it now, did include provisions to support informal carers. And I think the extent to which local authorities have been able to actually really implement that in the spirit in which it was intended is limited. And I think if you were looking at somewhere where you'd really want to focus early, it is on young carers, and say, actually, if we were prioritising, and inevitably we will have to prioritise, you know, to what extent are we being, especially with outreach. I mean, one of the issues often is if you're a young person, you're trying to do, you know, finish school, you know, look after your parent and all that. The idea that you've got time to devote to trying to interact with the public system to get what you're entitled to is not really very realistic. So how we reach out, there's a multi-agency activity to reach out to make sure that young carers in particular getting the support they need, I think is something very important to think through.
Okay, and I will stop now, but I mean, obviously it's very substantive, the question, but it does sound, you're talking about making the case for reform whereby unpaid and paid, they're on a spectrum, they're both vital, but it is that thing about if you're the unpaid carer, there's the choice to be able to have your good quality of life alongside caring for your family to the extent that you're able to. And that sounds like it'll be the best return on investment for the country as a whole as well.
Yeah.
Okay, thank you.
Thank you, very clear.